Welcome to the Chronic Pain Workshop. My name is Rick Chen, and I'm the presenter. Since 2018, we have been running the free community workshop around Brisbane. Up until August 2025, we have presented over 140 workshops, helping tens of thousands of people become pain-free. In this 60-minute workshop, you will witness a live demonstration on a real patient with a chronic and complex conditions, and see how it is possible to make significant and immediate improvements even if you have a scan showing bulging disc, degeneration, pinched nerve, or other pathology. You will understand how your chronic pain can also be solved without medication, injection, or surgery, often within 3 weeks. In this workshop, we will use back pain and sciatica as an example. However, the principle applies to all body parts such as the neck, the shoulder, the knee, and so on. We have also prepared 2 bonuses for you if you can complete the worksheet and send to us. The first bonus is a free book that I wrote, The 5 Steps to be Pain-Free in 20 Minutes. The second bonus is, if you want, you can see me for a comprehensive initial assessment at significant discount. You will get a thorough head-to-toe examination that I can guarantee you have never experienced anywhere before. I will even write you a report at the end of your session to address all your questions. You can get the discount if you stay until the end and complete the worksheet. I will help you fill in all the blanks on the worksheet as we go through the workshop. This will help you learn the key points. It is important that you go through the whole workshop. It will only take 60 minutes, and I'm sure for people with chronic pain that has not responded to other kinds of treatments, this will be your best 60 minutes ever spent. There are 2 ways to complete the worksheet. 1, you can print out the worksheet and handwrite the answers, or you can type in the Google form electronically. If you have any questions, you can type in the chat box or email us. We will get back to you as soon as we can. As I said, this workshop has helped tens of thousands of people pain-free. I look forward to seeing you pain-free soon.
So, my name is Rick Chen. I'm a titled APA musculoskeletal physio, and also I am an academic holder of lecturer. I've got a lecturer academic title with the University of Queensland, and I'm also a clinical educator for UQ. So a lot of physiotherapy students come to our practice for their placements. So these are my qualifications. So I did my master in manipulative physiotherapy, which means I specialize in the spine and the muscles and joints. And then I'm also a certified practitioner for several schools within physiotherapy, okay, that include Ridgeway methods, Mulligan, Trigenics, etc. I'm also an NLP trainer and founder of this clinic and also Original Point Therapy. The Original Point Institute is my training institute, which I teach many other students and including many other physiotherapists and doctors. I am an author and international speaker, and having over 20 years experience as a physiotherapist. So this photo was taken a few months ago, so before the pandemic, where I was teaching the treatment method to a group of physiotherapists and doctors in Taiwan, Taipei. Now, what is the real story of Rick Chen? Now, if you look at this picture, so this little girl was my sister, Alice, when she was 10 years old. And this man was my father. You can tell he is my father because we both have no hair. Right. So if you look carefully around my sister's neck, she's got a neck collar around her neck. So what happened was when my sister was about 4 years old. She fell down from stairs about 3 meters high. You know, there are railings on the side of the stairs, and somehow she managed to squeeze her body and head through that space, and then fell down to a glass desktop with her head and smashed the glass into pieces. Okay, and then straight away she fell down onto the concrete floor again with her head. So she had 2 hits in one go. So after that incident, she miraculously was okay, but ever since that, she appeared to be a bit clumsy, okay, especially when she walked and also with her hands as well. My parents thought, some kids were just clumsy, so didn't really pay much attention until my sister turns 10 years old. And then she had an MRI, and they found there was a C1 subluxation. Okay, if you know a little bit about anatomy or medicine, any injury above C3, a major injury above C3 can be potentially fatal. Okay, because that compromises one's ability to breathe. So my sister immediately had three operations. She actually had 3 major operations to her neck. And after the first 2 operations, she actually needed wheelchairs for mobility. So I can remember while I was in the ICU, I saw my sister has got so many drips and drains on her arm, and also a mechanical ventilator for breathing. Her arm was so swollen. It looks as thick as my father's thigh, and my father was a big man. So you can imagine the kind of stress and anxiety my family went through at that time. So while I was in the ICU, I said to myself, one day, when I get older, I want to become a physiotherapist and help people alleviate their pain without going through surgery. So years went by, I became a physiotherapist and set up this clinic, so pain-free physiotherapy and allied health, to fulfill the promise that I made to my younger self. So our business purpose is simple. We want to help people pain-free. That is why we run this workshop. Okay, we've been running the free community workshop for 3 years. And this must have been like the 82nd workshop we have run. So I want to thank you everyone for coming, because you being here actually helped us to fulfill our business purpose. All right, so the topic tonight is neck pain and headache. Okay, we do also have another workshop called back pain and sciatica. So it's online now, you might be able to watch it. So neck pain and headache. So who here has got neck pain in the past 30 days? So most of you, okay. Now, so does anyone have neck pain when working at a computer? Yes, okay. When you drive, anyone got neck pain when you drive? Okay. What about lifting? And what about sleeping? Yeah, I can see some people just have your hands up all the time. Let's do a quick demonstration, test. So if I get everyone to bend your head forward, bend down, okay. Hands up if you get pain bending forward, okay. What about bending backwards? Yes, okay. And turn to your right. And yep, hands up if you do get pain, and turn to your left. Yeah. Okay. And sideways. The other side. Okay. Oh, all right. So I see these ladies have your hands up all the time. Would anyone like to see a 5-minute miracle? Yeah. Right. So does anyone want to be a volunteer? Yes. You want to be a volunteer? Yes. Do you mind being in the camera? I don't know about your condition. Do you mind telling us your condition?
Yeah, I've got a bulging disc and spondylosis as well.
Bulging disc and spondylolisthesis, okay, which is the slippage of the vertebrae. Okay. What activities do you have trouble?
Pretty much I'm getting pain from everything now.
Everything. So sitting, walking, sleeping.
Sleeping, yeah, I wake up.
Yep.
I don't get a constant sleep.
Okay. So do you have trouble bending? Back, forward, backwards?
Yeah.
Okay. And turning?
Um,
Not sure?
depends, yeah.
Not sure. Do you mind being in the camera?
I don't mind.
Don't mind? Sorry, what's your name?
Lisa?
Lisa. Can we put our hands together for Lisa? Thank you for coming. So thank you for volunteering. And just a disclaimer, we've been doing the workshop for 24 times, and 90% of the time we get significant improvement within 5 minutes. Okay. How long have you had back pain for?
Years,
How many years?
like at least 8, 9 that I know of.
8, 9 years?
Yeah.
Okay. So if we can make significant change within 5 minutes, would you say that's pretty miraculous?
Yeah,
Yeah.
I mean, they've got me at surgery stage now.
Surgery, okay. And have you had any treatment before?
Yes, I've had steroid injections,
Steroid injection, physio.
acupuncture,
Yep.
what else? Drugs, obviously.
Mm-hmm. Okay.
Yeah.
So just about, yeah, like everyone here is similar. Okay. So just wanted to make a disclaimer. It's quite, although it's quite miraculous, and it feels good when we get a significant change within 5 minutes. If we don't get 5 minutes immediate improvement in 5 minutes, that doesn't mean that you are hopeless. Okay.
Yeah.
It just means we need more time to go through more detailed assessment to find out the underlying cause.
Yeah.
Okay, so don't put too much pressure on Lisa. Okay. All right. So what I would do is I just need to put my hands on you, and I need to do a couple of assessment first. All right. So if I get you to maybe stand facing that way, and yeah, I just want you to bend forward and stop as soon as you feel any tightness or discomfort. Okay. About there in the back, isn't it?
Yeah.
Okay, just let your arms hang down. So it's about there. Okay, so stand up straight. So that's about just right at the bottom of your knee.
Yeah.
We might need you to be the judge. Yeah, so you are in the best sitting. Okay, or maybe, yeah. And I'll get you to bend backwards. There already.
It doesn't go very
Yeah,
far.
it doesn't like it, isn't it?
No.
Okay. Now I'm just going to put my hands. Okay. I'm going to feel with my hand from your head to your toes. A normal muscle or joint should feel soft,
Yeah.
no pain.
Yeah.
Okay, so soft like that.
Yeah.
If it hurts, then and feels tight, that's not normal. Okay. You're going to tell me the most tight or the most painful spot that I touched. Okay. By the way, this is the procedure that we go through. It's a standard procedure, part of our standard procedure. We wanted to feel the whole body, because a lot of the time the actual cause is not in the back. It could be somewhere else, anywhere in the body. That's why we need to go through a thorough assessment like this. Okay. Ooh, quite tender there. Oh, it's really tender there. Yep. Okay. And then if I keep going down. Okay. Probably the best way is from there. That's okay. Just take the camera. Okay, that's quite tender there. Oh. You're happy? Okay, keep going. You got really tight calf muscle. Ooh, there. Yep. And quite tight
Yeah.
there as well. So which one hurts the most, the shoulder or the calf
I actually think
or the
that-
hip?
I actually
can-
think, yeah, that hurts.
That one
the
hurts
most.
the most.
Yeah.
That one hurts the most.
Yep,
Okay.
that one.
All right. Good. So where do you normally feel the discomfort, the pain
I feel it mostly through this area,
in that area?
through the middle of my back,
Okay.
and then I get a burning sensation in my feet.
Burning sensation in the feet. Okay. And you said you got a bulging disc and spondylolisthesis. Okay.
So basically, the MRI showed that I got like
Okay.
that.
Just show people. Maybe we take one step back. So,
Yeah.
so what's your name?
Evelyn.
Evelyn. Judge Evelyn can get the best of you. Okay, just show Judge Evelyn how much we can bend. About there starts
Yeah.
hurting. Okay.
Okay, right.
And backwards. Not much.
No.
Okay. All right. The next thing I'm going to do is I'm going to treat the previously painful spot. Okay. And at the same time, you're going to do the same, do the movement forward
Okay.
or backwards. Okay. If we hit a really good spot, you'll find all of a sudden the movement improve quite significantly. Okay. Also, just a bit of warning. Some people may actually feel a bit dizzy.
Okay.
Okay, because we hit a really good spot. If you feel dizzy, you let me know. Okay, we don't want ambulance tonight. All right.
Let me go forward.
That's all right, in a minute.
Okay.
I'll tell you when. Quite tender there, isn't
Yeah,
it?
it hurts.
Okay. All right. Ooh. Okay, let's bend forward. Sorry, hurts where?
That way.
Oh, hurts here.
Yeah.
Okay, I just want you to focus on here. If this hurts, you stop. Yeah, here hurts, that's normal.
Yeah.
Okay? Sorry. Okay, let's bend forward.
Yeah, you get more, definitely.
Ooh, is that better, Judge Evelyn?
Yeah.
Yeah?
Absolutely.
Okay, one more time.
Yeah, it's like you
Yeah?
released it. Yeah.
Feels better?
Yeah.
What about bending backwards?
No, I'm stopping there.
Okay,
Yeah.
just let me find the spot again. Okay, bend back. Actually, better. Yeah. Okay, one more time. Bend. Thank you. Okay, just try bending backwards again yourself without me.
Yeah, it's better.
Better.
Yeah.
Of course. Is that miraculous enough? So we only have
Feet uncomfortable?
I mean, no, I don't feel uncomfortable afterwards. It's only uncomfortable during.
only
And-
the pressure,
and you
only
can
my
really,
pressure.
Really feel the pain spot.
But how do you feel now?
Just normal.
So we have only done like 20 seconds of treatment, and it's already
Yeah.
you already
oh, yeah,
feel
no,
the
you definitely
difference.
felt the difference.
What if
especially
we
go back.
do 20 minutes treatment? How much better would that be?
Yeah.
Okay, okay. Let's put our hands together again for Evelyn. Thank you. So would you like to know why that worked so miraculously? Let's get into it. Okay. So do you all have, in your folder you should have a worksheet with you. Everyone got a worksheet? Okay. Everyone got a pen? Just make sure you have a pen, or if you don't have a pen, just ask our staff. Okay. So there are many blanks. We're just gonna go through the worksheet and fill in the blank. If you can complete all the blank, I'll give you this book that I wrote for free. Okay, so the book is the 5 steps to be pain-free in 20 minutes. Who wants to be pain-free in 20 minutes? Okay, all right, let's get to it. So number 1, what is sciatica? What is sciatica? Okay, the sciatic nerve is the thickest nerve in the body. Okay. Thickest or biggest or largest, yeah. So the sciatic nerve is as thick as the cable here. Okay, so it's pretty thick. So it travels from the lumbar spine So everyone write down 1A, largest or thickest. And then 1B, it travels down from the lumbar spine, down the back of the leg. Okay? So 1B, lumbar, Lumbar, and then leg, leg. So 1C, sciatica sufferers may experience pain, numbness, or tingling in the leg. Okay, everyone write down pain, Pain, and tingling, Tingling, tingling sensations, pinprick, yeah. Okay. If you have any question, you can just ask me.
Sciatica, because he told sometime he have left side and sometime he have right side. So is that possible?
Yes. Yes, sometimes.
I was thinking it's only one.
Usually should be one side. Most of the time,
Yeah,
yes.
he told
But
me
sometimes it can.
he said one side.
Sometimes it can, yeah.
Okay.
Or sometimes you may have trouble, you may have problems on both sides, so you get pain on both sides. Okay, we have many people here with neck pain, so we want to talk about neck pain as well. So 2A, number 2, why people get neck and arm pain. So 2A, the nerve supplying the arm come from the cervical spine. So cervical spine, if you are American. So cervical spine or cervical spine, everyone write down 2A, cervical. And 2B, if the nerves are affected, then people may experience, again, pain, numbness, or tingling in the neck and arm. So pain, tingling, so for 2B. And then 2C, cervical disc herniation or bulge can compress the nerve, causing severe neck and arm pain. So this is the disc. If everyone look at the slide here, so this is the disc, and the yellow bit is the nerve. So the disc may protrude backwards and pinch on the nerve, causing arm pain. Okay, this is what your doctor will tell you, or your physio chiropractor will tell you. But I want to say, in our practice, we believe in a very different model. So we have a very different approach. Okay, so I just want you to be aware. So this may not be the cause in a lot of the time, we believe. So there's 3 common causes of low back pain according to mainstream medicine. So this is what your doctor will tell you. I want to preempt, this is what the doctor will tell you, but this is not what we believe in, okay? So if there are 3 common causes. The first one is stenosis, degeneration, arthritis. Everyone write down arthritis. 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 A disease called old age. Okay? So if you have pain with standing or walking, you most likely will get this diagnosis from your doctor. Okay? Number 2 is herniated disc. Everyone write down disc, D-I-S-C. So if you have pain bending forward, you most likely will get this diagnosis, herniated disc. And then the number 3 is SIJ or pelvis pain, pelvis problem. Everyone write down pelvis. So if you have pain sitting, you most likely will get this diagnosis from the doctor. But I want to emphasize over and again, this is not what we believe. Okay? And similarly, for people with neck pain, okay, you may have the 3 most common type of neck pain. Doctor will tell you stenosis, degeneration, arthritis. Okay, if you have pain bending backwards, everyone write down 4A, arthritis. And then 4B, herniated disc again. So if you have pain bending forwards, so 4B, everyone write down disc. And then 4C, muscular problem. If you have pain with rotation, okay, or side bending. So muscular problem. All right, so repeat again. This is what doctor will say to you, but this is not what we believe in. Okay, to understand how what we believe, we need to talk about the function of pen. So number 5, pen protects the body. Everyone write down 5A, pen protects the body. Okay, pain protects the body by changing our behavior because pain is an unpleasant sensation. Okay, if we experience pain when we're doing something, then we will avoid doing it. Therefore, protects the body. Does that make sense? Okay, so pain is a warning. Everyone write down 5B. It is a warning that there is a threat in the body. Okay, everyone write down warning. Okay, let's use police as an analogy. So pain is like police. So if there is a car accident in a busy traffic intersection, police will come to the scene to redirect the traffic. Okay, what would happen to the traffic if we remove the police before we clear the accident? Yeah, the traffic will become more chaotic. And then sooner or later you will need to have more police. Okay? So pain is like police. So when there is an injury or a threat in our body, then we get pain as a warning. Okay? Therefore we stop, we rest, we protect the body parts. If we remove the pain before we deal with the injury or the threat, for example, by taking medication, okay, then what would happen to the injury? It gets worse, and then you will need more pain sooner or later. Okay? So if we treat the cause, if we remove the injury, if we remove the threat, then the pain disappears. There's no need for the warning anymore. Okay? However, if we just treat the pain, it is similar to removing the police from the traffic accident. Okay? Then there will be more problem and more pain. Okay? So if you are taking pain medication for your pain for a long time, you will notice your pain becomes worse and worse. Okay? So how do we fix the pain then? The first step, we need to ask this question. Is the pain, so number six, is the pain, numbness, or tingling reproducible? Okay, everyone write down reproducible. Because if it is reproducible, then it is likely reducible. Okay, if it's reproducible, it is by movement, it is also likely reducible with movement. That's why in the beginning of this session, I asked everyone to stand up and bend. Okay, and the reason is I wanted to see if the movement can reproduce your pain. If movement can reproduce your pain, then it is also likely reducible. Okay, now, so let's use another example. When red light flashes on your car dashboard, how can we stop the red light?
Fix that problem.
Okay, we find the mechanics, diagnose and fix the problem. Okay, and then the red light will stop flashing. There is another way. You get a really dark cover, cover it up, the dashboard, and the red light appears to stop flashing. But does that solve the problem? No. We know that for our car, but what about for our body? Okay? So when the red light to the car is like pain to our body, when the red light flashes on our car dashboard, we can find the mechanics, diagnose the problem and fix it. Okay? Or we can put a dark cover over it, but you won't fix the problem. Okay? When there is pain in our body, okay, we can go to see a physio. Like in our clinic, we do original points therapy, okay, to really diagnose, find out where the cause is and fix it. Okay. There is also another way. You can take drugs, or you can go and have a a good rub. You may feel temporarily better, but sooner or later the pain will come back because you haven't really addressed the cause. Okay? Now, this is one study that we did in our institute. So it involved 348 subjects. Okay? And 4 people with. So let me go through this table here. So this vertical column here, these are the area of pain. So where are the pain when the subject comes into the study? Okay? And on this horizontal row here, these are after our physiotherapist examine, run through a thorough assessment, where do they find the cause is. Okay? So that's the cause of pain, and here is the area of pain. So if the area of pain matches the cause of pain, then they will be shown in the pink boxes. Okay? Now, let's take low back pain. So back pain as an example here. Okay, so this row here. So if we add up all the numbers on this row, okay, there are altogether 80 people. So 9 plus 3 plus 23 plus 9 plus 1 plus 29 plus 4 plus 1 plus 1. That's altogether 80 people presented to the study with low back pain. Okay? And then only 1 plus 29, so only 30 people have their cause in the lower back. Okay? If we look more carefully, there's a 1 and there's a 29. So that 29, it says anterior lumbar. Anterior lumbar means here, the stomach area, the front stomach here. Okay? So out of the 30 people, 29 out of the 30 people have the cause in the front. That leaves only 1 person, okay, out of 80 have the cause of the low back pain in here. So what do you do if you have low back pain when you go to see a physio, a chiro, or a massage therapist, or whatever? What do? They work on that spot. And according to this study, you only have 1 in 80 chance of getting the cause fixed. That's not very high, isn't it? Okay? So what's the message here? So in order to achieve consistent result, like we did in our 5 minutes demonstration for every workshop, including Renan, we need to do a thorough head-to-toe examination, not just looking at the area of pain. That's the key message tonight. Okay? Now, is that clear for everyone so far? Good? Yeah. Now, for people with neck pain, same thing. So, neck, if we look at this row here, okay, same study. So, altogether, there are 59 people presented to the study with neck pain, okay? And only 27 out of the 59 people have the cause in the neck. There are actually more people have their causes outside their neck. So you can't just look at the neck when you treat the neck pain. Yeah. Clear? So now let me show you some example. So this lady, 17-year-old lady with low back pain, couldn't walk very far, and I treated her calf muscle, and immediately she was able to bend down a lot further. So the photo was taken like only 30 seconds apart. And then this 35-year-old mother with low back pain, she could only walk for 10 minutes. And she tried over 10 types of treatments, not getting the result she wanted. In fact, she saw a specialist who prescribed who diagnosed her as a neuropathic pain, and gave her antidepressant. Okay, and she actually have suicidal thought. This lady. Okay, if you have 5 young children and you can only walk for 10 minutes, you can imagine how depressing that would be. Okay, so we actually found the cause of her back pain comes from her gluteus muscle, the hip. Okay, so after 5 sessions, she managed to fly down to Melbourne with her friends and went shopping, so 5 blocks. She was very happy. Yeah. This case 3, 55-year-old warehouse laborer, so low back pain affect his sleep. Okay, we actually found the cause of his low back pain was from his shoulder. Okay, so by treating his shoulder, he was able to bend down a lot further. Okay, so it's similar to Rendon. Yeah. So case 1, case 2, case 3, they all have same symptom, back pain. But case 1, the cause is in the calf. Case 2, the gluteus, the hip. Case 3 is in the shoulder. Okay, so it's same symptom, but different causes. Okay, just to confuse you a bit more, case 4. So this gentleman, he's got neck pain, and I actually treated his shoulder. Okay, and he was able to turn a lot further. You can see his nose on this picture. This one you can't see his nose. Okay, and then case 5, this lady with chest pain, difficulty breathing, couldn't turn very much. I also treated her shoulder. I was able to turn a lot further. So now case 3, case 4, case 5. This time they have different symptoms. Case 3, back pain. Case 4, neck pain. Case 5, chest pain. But now the cause are all the same. They're all shoulders. So different symptoms, but same cause. You say, hang on, Rick, 3 slides ago, it was same symptoms, different causes. Okay, but now it's the other way around. What is going on? Okay? So again, the message is, in order to achieve consistent result, okay, we can't just treat where the pain is. We need to check the whole body. Got it? Okay? Some people may have neck pain, so this example of neck pain. So this gentleman, I met this gentleman in a conference, and he couldn't lift his head. He can't look to the podium, look up to the podium. He knew I was a physio, so he asked me for help, and I treated his neck, and he was able to bend backwards a lot further. You can see his big smile on his face. Yeah. And then this one here, this lady, 20-year-old lady with acute neck pain, I actually treated her jaw. She couldn't bend her head down. I treated her jaw, and she was able to bend down. And one day later, she was able to bring her chin to the chest by treating her jaw. Okay, and you've seen this gentleman already. He's a concreter, and I treated his shoulder and improved his neck pain. So again, all neck pain, but different causes. Okay, and then this man, shoulder pain improved by treating the shoulder. Oh, this man is a classic. He's a classic. He's got back pain and sciatica, and he was 30 years old when I saw him. And he told me he was stuck in that position. That's as far as he could bend for 10 years. From his 20 to 30, he could only bend like that. And he came to see me. I spent about 15 minutes on him doing a thorough assessment. And he was able to bend down in one session, that much. And then he cried. He said, I've been stuck in that position for 10 years. I've been seeing so many different doctors having different treatments, and in only one session, and I was able to bend down so much. I almost feel like my 10 years of my prime time was wasted. It was such an easy fix for him. Yeah. So, different symptoms, same cause. Okay? Again, look at the whole body. not just treat the area of pain. Okay. So, how do we treat it successfully? Number 7, we do original point therapy. Everyone write down number 7, original point therapy, OPT. So what is OPT? OPT, the main principle is 7A, the cause of pain is often different from the site of pain. Okay? The cause of pain is often different from the site of pain. Everyone write down 7A, different. And there are 3 phases. Okay? Everyone write down 3 for 7B. So phase 1 is OPT diagnosis. Diagnosis, everyone write down diagnosis. Okay? And phase 1 has 7 steps. Okay? So everyone write down 7 steps. Sometimes the condition may be more complicated and we need 1 extra steps. Okay, so write down 7 or 8. Yeah, plus 7 or 8 steps. Okay? So after we diagnose the cause, then we can focus our treatment on the real cause. Because that goes into phase 2. Phase 2 is OPT, fix. Everyone write down fix. And many people ask, how many sessions does it normally take to fix? Yeah. It varies from people to people. But as a rule of thumb, generally it takes about 6 sessions. Generally, everyone is different, but on average about 6 sessions. Is that? 6 sessions, yep.
Do you require the patient to do a lot of exercises?
We teach people exercises according to the cause. For example, Renan, even though you have back pain and sciatica, we found the cause was in the shoulder. So the exercise is actually targeted at his shoulder rather than the lower back. It's very different to any other physio, any other treatment, because in Renan's case, physios would have prescribed like core muscle exercises around the lower back areas, okay? But our treatment should be directed towards treating the cause. Where is the real cause? It's in the shoulder. So our exercise would be directed towards the shoulder. Because we treat the cause, not the area of pain. Okay, that's a very good question. Okay, now after we fix, okay, and the patient goes back to normal daily activities, okay, there are still chances that he may adopt the bad posture again, or do repetitive lifting work. Okay, so that shoulder, for example, in Renan's case, will still be under stress. Okay, so after that, it's like taking your car for, you take your car out for service every now and then. Okay, so you take your body here for service every now and then as well, as an analogy. Okay, any question so far? Yes?
So you said after 7 sessions, 6 or 7 sessions,
Yeah.
the pain will disappear, but it can come back too.
It's like you have a tooth problem. You go to see a dentist. The dentist fix it up, okay, and then send you home. If you don't brush your teeth regularly, okay, if you don't take care of your oral hygiene, will you still get tooth problem? Yes. Okay. Similarly, with physio, we fix your condition up, okay, and we send you home with exercises and give you tips about your posture, how to maintain good posture. If you can be really, religious with your exercise and posture, I think you don't need to come back and see us that often, okay? But if you're too busy to look after yourself, then chances you may need to come back to see us earlier. Yes? Good. Any question? We get this question all the time.
What about those you see the mentioned about build? Are they really works or what?
Sorry, what's the question again? Those people who bug
There's
you?
a lot on the internet, talking about build, sciatica build, something like that. I don't know.
Sciatica
Sciatica build.
belt
Yeah.
or the back brace. Back brace can often be a good adjunct to the treatment, because in your case, most likely you will benefit from a back brace. I'm not saying you must have it, okay? But from our example, from our experience, because you are so tight here, okay? When I check you, I actually feel you are very loose, rather loose in this area. You are also, and then again, you're very tight down there. So it's like, imagine the body is like a spring. It's like springs connected together. It's very tight in this part here, part 1. But part 2 is very loose. Part 3 is very tight again. So every time you bend, here, part 1 and part 3 can't really move. So most of the movement happens in part 2, in the middle here. And then, so this part becomes subject to a lot of stress. And therefore you get back pain and sciatica. Okay? So if you can wear a belt to tighten it up, the chance is it will help, make the body more balanced and help. Yeah, but everyone is different, okay? So this is just general advice. We need to do individual tailored assessment to advise you whether or not it will help. Okay?
And
Yeah.
one more thing, because I mean, my work, I like mostly sitting on a forklift. Like, if I cannot feel the pain going through my leg, it's gonna be like wrap around the here.
Into the front.
Yeah.
Into the front. Okay. Yeah. Of course, we need to examine you in more detail. That was just a very quick assessment, quick show. We need to examine you in more detail. But if the cause was from here, okay, often the pain can be quite widespread. Okay, it can be some people with a cause here can have neck pain. Some people may have back pain. Some people may even have pain in the front here. Yeah. We have people with knee pain, can't walk the stairs, and we treated this point and fixed up their knee problem. So there is no real pattern. You can't say, because my pain is here, it must be caused by a certain structure. You can't say that. Yeah, that's why we need to check the whole body. Okay? We get this question all the time, so I prepare a slide. So this is MRI. So every day I have patients coming to see me with this kind of MRI. This is the MRI of the lower back. And you can clearly see this is a bulging disc. Okay? So bulging disc, so a normal disc should look like this. Okay? And this is a bulging disc. So it's protruding backwards and put pressure onto the nerve. Okay? So every day we have patients like this, and 90% of the time we manage to fix them up, and they manage to help them restore their normal daily activities. Okay? So the scan does not always correlate with pain. Every doctor knows that scan does not correlate well with pain. 90% of the time, this is just a normal aging process. It is like getting gray hair. So if you are 70 years old, you get gray hair, that is pretty normal. Okay? But if you are only 20 years old and you get gray hair, then probably something is wrong. Yeah? So if you are 70 years old and you get this kind of scan, it's actually quite common. It's quite common. But the thing is, if you got back pain, who gets back pain? Usually people over 40 years old. Okay, they start to get this kind of scan, and they got low back pain, and they go to see the doctor. The doctors will look at this. Doctors don't really do the examination like we do. Okay, they will send the patients to get a scan. Okay, and then when the scan comes back, it is very convenient for the doctor to point to the scan and say, "This is the cause of your back pain." Where a lot of the time it's just a normal aging process. So imagine people having unnecessary surgery because of the scan. So if the cause was in the shoulder, okay, and then you have a scan like this, and you get a surgery, would that help? No, it's probably going to make your problem worse. Okay, so 90% of the time, we can improve their function. Okay, so it's important that we identify the 90% so that we can prevent unnecessary surgery. Okay, it is also important that we identify the 10% that really need injection or surgery and refer them on so we don't delay their recovery. Okay, so correct differentiation by our physical examination is very important. We can do, we can run through tests to identify whether you are the 90% or the 10%. Any question?
Do you have high caps?
High caps? Oh yes, we have high caps. Yep. So for the neck, it's the same. People coming with neck pain and then with this kind of bulging disc, same thing. A lot of time it's just a normal aging process. 90% of the time we can really restore their normal function. Any more questions about conditions? Yes?
Can you determine what the problem is without an X-ray?
Yep. If you think about this, X-ray or any kind of scan, it's a visual tool, okay? But our hand, you can cover my eye, okay? For Renan, you can cover my eye. I feel with my hand, it's a tactile sense, okay? So I diagnose with my hand, with tactile sense rather than a visual measure like X-ray, and it is actually a lot more accurate for 90% of the time. Yeah, of course there are conditions that we rely on. We need to rely on the imaging. Any more question? All good? Yes?
Session time.
Normally half an hour. Normally half an hour. Yeah. Just very quickly run through headache and migraine here, because who here has headache or migraine? Yeah. So quite a few of you. So headache and migraine, there is actually a very close connection between the neck and the face, especially this part, around the eye part. Okay, there's very strong neural connection. So people with neck pain can experience pain in the head. There are over 100 types of headache. Migraines and physio work really well for those that arise from the neck muscles, from the muscles and joints. And doctors often overlook muscle joints as the cause. Okay? The predictors of success by physio, everyone write down number 8. So how can we know the treatment will work? First, if there is a joint muscle dysfunctions, especially in the neck, everyone write down 8A, dysfunctions. So what is dysfunction? For example, knot. So like, if you can feel knot in the body, okay, it's not smooth. For example, if there is stiffness in the joint, there is a reduced range of motion, okay, those are dysfunctions. Okay, and second one is headache does not change side much. AB, write down, does not change sides much. So if a patient said to me, oh, my headache is always on the right side, okay, then the chance of successful treatment will be really high. Okay, it's most likely coming from the joint or some sort of structures around this area. If it's 90% on the right, 10% on the left, Still very good chance. Okay, but as it goes down, 60-40 or 50-50, it becomes a bit harder. Doesn't mean we can't fix it. Okay, it just becomes a bit tricky because some headache, if you keep swapping sides, you might need to check if there's a vascular component of it. Okay, but you could have dysfunctions on both sides. Okay, so that's something we need to look into. Okay, and 8C, if treatment reproduces headache and then lessens as the pressure is sustained. So everyone write down 8C, if the treatment reproduces headache and then lessens as the pressure is sustained, then it's also a good predictor. Okay, if you wanna, the key to success is your physiotherapist must have very accurate diagnosis. I've seen so many physios not able to diagnose the right structure and therefore missed out a lot of causes of headache. And then they need to have very sensitive hands for palpation. Okay, that's the key for success. Whiplash. Anyone here has whiplash? So car accident. One. You have one too. You have one too. Yeah. It's an acceleration deceleration injury. So it's also very complicated because the nervous system becomes very sensitive. There could be psychosocial impact. Some people may lose their car, lose their job, okay, or have a post-traumatic stress. So legal issues, compensation may be involved. So we really need a team approach. In addition to physio, we need doctors, we need lawyers, we need case managers, etc. Yes.
How long does whiplash meant to last?
How long will it last? It varies. Some people, a day or two, gone, normal whiplash symptoms. Some people, drags on years after years. It's very different.
If it lasts for years after years, what would be would there be a solution to it?
Yeah, I think the first thing is we need to, run through the test and find out where exactly the cause is, because most physio would just treat the neck, but the cause can be anywhere else. So we need to run through that. Okay. And the second thing we need to ask this question: is there any psychosocial issues involved? Okay. You may lose your car. Your job may be at risk, or there are many other things. Is there a compensation involved? So it becomes more complicated. So we can have a private conversation after this. Yep.
Many of my problems started when since I was really very young.
Mm-hmm.
Since my parents realized that I had very incorrect postures.
Incorrect postures.
Yeah,
Okay.
I mean, since I was young, I was reading the newspaper just staying on the ground,
Yeah.
and so being
Yeah.
curved.
Yeah.
And so I started having very young, light scoliosis.
Scoliosis.
Then, that was corrected by making lots of sport.
Okay.
But then, when I was already at 40, I started to have very bad
Yep.
back pain.
Okay.
How can you correct these postures? Because sometimes
Yep.
I am told, say, hey, look, be seated
Yeah.
correctly.
Yeah. But that actually makes you more painful.
Because
Yeah.
I do not realize it.
Okay.
For me, that's the normal way to sit or
Right.
to stand, and I am not doing well.
That's
of
right.
course.
So anyone with children, be mindful, because the poor posture during their childhood can cause problem when they become an adult.
And how can you correct that?
Yeah. Now, number one, scoliosis may not be the cause. May not be the cause of your back pain. Okay, scoliosis may not be the cause of back pain. In fact, a lot of scoliosis are self-limiting. They don't cause pain. So don't want you to worry too much about it. Especially at your age now, the bone growth has already matured. It's not likely to get worse.
No, for sure. But
Okay, yeah. However, the muscle imbalance, because of scoliosis, you may develop muscle imbalance. You're more likely to develop tight muscles or loose muscles. Okay, muscle may be too tight or too loose. Okay, and that can predispose you to pain. Okay, so yeah, we can still help you release those tight muscle or strengthen the loose muscle and become more balanced, and that will also help you alleviate your pain. So, and then a lot of the time, even though the pain may be in the back, the cause can be somewhere else. We need to look at the whole body. Okay, and help you correct your posture. Many people don't know what good posture is. Yeah, it starts from the pelvis.
Is that comfortable posture is the correct one?
The comfortable posture, a lot of people want to sit up straight. They think that's the right posture. It may not be. It may not be. Okay? So it's different for everyone. It's different for everyone. For example, a shorter woman, okay, sitting in a chair, we would recommend you to sit back with your back resting against the backrest and even put a block under your feet. Because a lot of the time, women like to sit only at the front edge of the chair, like that. Yeah, and their back is always arched. And over time, it's like bending your finger like this, okay? Over time, you're gonna get sore. So sitting gracefully, elegantly like this for ladies may not always be the right thing, okay? And many people don't realize that, okay? So what is a good posture? It depends on every individual. People with very tall men, they often have to look down on people and then often sit down with their legs are too long, so they are always like that. Yeah.
My son is like
That's right, yeah. So in that case, I would ask them to sit up straight or even put a cushion underneath, okay, so that their hip becomes higher or at least at the same level as their knee. So everyone's different. So the posture is very customized. We need to customize our posture prescription. Okay, yeah. Yeah, any more questions? Well, I've covered pretty much. Now, so how much is the value to be pain-free? If we just throw in some arbitrary figures, being able to work $4,000 per month, being able to sleep $2,000 a month. I have a patient who told me, if you can help me sleep one good night, okay, I will pay you $2,000. That's how bad his back pain is. Okay, just sports fitness, just some arbitrary figures, gardening. What about quality family time? Can you put a price on that? You can't. Okay, it's priceless. So altogether, the total value is $10,000 per month plus quality family time. Okay, so how much do we charge tonight? Okay, at special rates for detailed assessment. Okay, to thank for your effort, making an effort to come to see us. Okay, so with me for 30 minutes or at special rates with Quentin. Quentin is a certified practitioner of original point therapy. We want to understand your problem. Okay, we only take you as our client if we think we can help you. Okay, and then we want to run the first 3-4 steps of the diagnosis phase. Okay, after that we will have a written report for you. We want to tell you what is wrong with you, what we think is the cause. Okay, what treatments you need, and how many sessions will it take to achieve your goal. Okay, so after that you can decide whether or not to continue with the treatment. It's normally normal rate. Okay, it's only special rate by filling up the last page on your worksheet. Okay, so there's a condition for special rate detailed assessment. It's special rates. If you turn up to the appointment, if you book and you turn up to the appointment, it's special rate. If you do not turn up and you do not give us 2-day notice, then you agree to pay the full normal rate for the time wasted. Okay? Why do we need to have this rule? Because if someone book in the session and don't turn up, what would happen? It increases the operation cost of the business. It wastes my time, and other people who need the treatment cannot get in, and that person himself, will he get better? No. So everyone loses. Okay, so I'm happy to see you at a discounted rate, but you need to agree that you will turn up to the treatment, to the appointment. Is that fair? Yeah? Yep, very good. So special rate, just enough to cover the rent and staff wages. And in fact, this will be the last time we will offer special rate. Okay, so optional if you can consent to us videoing your session for teaching and marketing purpose. As I said, I'm a teacher, I'm a lecturer. I'm constantly looking for good cases to share. It's optional. The other one is you like and give feedback on our Google reviews about this community workshop so that more people can come and benefit from this workshop. Okay, I'm sure.
What is your usual fee for each session?
Okay, so you can help us grow our Google review by scan this and give us a 5-star about this workshop. Okay. Now, after assessment, you can continue to see me. That's my fee, or you can continue to see our experts. We have many experts here. We have about 10 experts here. Okay. Now, if you really need help and you have financial hardship, please talk to us. Come. So I'll be staying here answering any individual questions you may have, and we'll have 2 desks open if you want to take up the discounted offer, and also get your book if you want. Thank you for watching this chronic pain workshop. Have you completed your worksheet? If you have, we want to give you this book, 5 Steps to be Pain-Free in 20 Minutes for free. Also, if you want to take up our special offer and get a comprehensive initial assessment with me, you can do one of the following 3 things to get a discount. 1. If you handwrite the worksheet, tick the yes button at the end of the worksheet. Take a photo and send it to admin@painfreephysio.com, or you can post it to us. 2. If you use Google Form, you can simply hit the submit button on your completed Google form. 3. To make it even more simple for you, just contact us and mention the promo code Chronic Pain 2025. If you have any further questions, feel free to write to us or give us a call. We promise to get back to you within 2 working days. We hope you enjoyed this workshop, and we look forward to seeing you pain-free soon. Sorry, what's your name?
Carrie.
Carrie. Would anyone like to see a 5-minute miracle? Yeah? Right. So does anyone want to be a volunteer?
Yes.
You?
I don't want to be a model.
Can I just ask a couple qualifying questions? So tell me about how long have you been getting the neck pain?
Maybe 6 months.
6 months. Have you had any treatment?
Yes, a lot.
A lot of treatments. Did you have any surgery? No surgery. Any medical conditions? No. Okay, right. So you don't have any metal implant put into your body? Okay, all right. Sounds like a suitable candidate. I haven't seen you. I haven't touched you at all. Do you mind being in the camera? That's all right. All right. Sorry, what's your name? Aneta. Okay, let's put our hands together for Aneta. Okay, so just a disclaimer. We've been running workshop like this for more than 80 times, and we got significant improvement for over 90% of the time within 5 minutes. But would you say it's pretty miraculous if we can change someone's neck pain within 5 minutes? Okay. Now, but in case we don't get significant improvement, it just means we need more thorough assessment, because Aneta's condition may be more complex. Okay. So not getting significant improvement within 5 minutes, it doesn't mean Aneta is hopeless. Okay, so let's not put too much pressure on Aneta. Okay. Sorry, feel nervous.
I feel a bit hopeless because I've had a lot of treatment.
You had a lot of treatments already. Yeah. Okay. Yeah. All right. So tell us about your problem. Where do you feel the pain?
So in the upper cervical spine,
In the upper cervical spine.
there is degeneration in the atlantoaxial joint.
Okay.
And then further down, there are two disc
Mhm.
bulges,
Okay.
the C3 and the C4.
Okay.
And
These
A
bulges.
little bit further down, I've got mild spondylosis.
Spondylosis.
Yes.
Spondylosis, it means, is also another word for degeneration.
Yeah.
Okay. Sorry, how old are you?
I'm 36.
36.
Yes.
Still very young. And you had many treatments. What treatment have you had?
So I've had 4 months of physiotherapy, and my physiotherapist performed the Watson's technique.
Okay.
And
For your headache.
yeah, for the headaches.
For the headache.
And that subsided, that helped.
Okay.
But my problem is when I sleep.
When
I've
you
also
sleep.
had osteopathy. I've also had electroacupuncture
Mm-hmm.
and MLS laser therapy.
Okay. So you have many treatments already.
Yeah.
4 months of physio. And how's your condition now? Still quite sore?
What's better is that the headaches have subsided.
Yep.
So I don't wake up with headaches. I was waking up with headaches
Okay.
for over 4 months.
Okay. What's still bothering you?
But yeah, there's no neurocompression.
Okay.
I have my MRI results here.
Okay.
But the problem is when I sleep.
When you sleep.
It feels like the hand of death is going into the C3, C4
Okay.
and squeezing it.
Okay. Right.
So I have to
So
constantly-
sleeping is the main thing.
Yeah.
What about working at computer or
Yeah,
something
when
also?
I'm at my computer,
Right.
when I'm working,
Okay.
it still feels
Okay.
irritating.
Okay.
Yeah.
Yeah. So for demonstration purpose, it would be best if we can get someone with the restriction with their neck.
Yeah.
You do have restriction with your
Yeah.
neck. Okay, good. Because you had your hands up all the time. That's right. That's why I picked you. It's better dramatic effect. Now, so we're gonna do a few tests, okay? If you feel any tightness, any discomfort, I'd like you to stop and let me know, okay?
Sure.
Maybe let's move it over here a little bit so we can just make sure that camera catches us, okay? Good. All right. Okay. So I'll just get you to turn to the left. So it's about 50 degrees. So if you're a bit tight, or
Yeah.
yeah, okay. And to the right,
It's very tight.
very tight. Sorry. As soon as you feel tight, you can stop. Don't push. Okay. Right. Sorry. Okay. And we need a judge, like this lady in the middle. Sorry, what's your name? Chantal. Chantal. Can you be Judge Chantal? Yeah, okay. All right. So about there and about there, okay? What about sideways? There, okay? About 15 and not very much. Sorry?
It's a little bit better.
A little bit better?
Yeah.
This way, okay? What about if you cross your arms in front of your chest? Okay, and turn your body to the left. Okay, that's okay. So 70, and to the right. That's it. Sorry, to the right again. Feel there, can feel something
A little bit.
a little bit. But when you turn this way, you feel okay.
It's starting to stiffen up now.
Stiffen up now already. Right, it's only a couple of minutes of sitting. All right, so the next step, I need to feel with my hands, okay, from your head to your toes.
Okay.
If you feel any tightness, please let me know, okay?
Sure.
So we start from here.
There.
You can feel really tight in that jaw muscles, okay? And so keep coming down. Oops. Thank you.
Rather,
Yeah.
a little bit further down.
Sorry, a bit further down,
Yeah, there.
like there. Okay, so C4. 4 on the right, and oops, quite tender there as well. Okay, and then going down there. Okay. Left side seems to be a bit worse. Hey?
Yeah.
Yeah. So the front there as well. Okay, oops. Now, ooh, quite sore there.
Yeah. It's wonderful.
It's wonderful?
Yeah. No,
Sore but
I'm
wonderful?
Just kidding.
Just kidding. I can press harder.
Lots of sarcasm.
Yeah. It's fine there.
It's fine there.
Yeah, no issues down
It
there.
actually feels a bit tight in there.
Yeah, that is tight. I didn't realize that.
Mm-hmm. And
It's okay.
it's okay. So there's a point under the armpit I need to check. So just relax. It's okay. And this one under the armpit. That's okay. Right. So I'm just feeling alongside the spine. And then, sorry, going down to the leg.
It's just muscular pain though, because I did a class.
Okay,
last night, so
right. By the way, this is the standard assessment procedure that we do in our usual sessions. But in the sessions, it's usually a lot more comprehensive than this quick screen. Okay, it's quite tight there, isn't it? Okay. All right. So, quite a few tight spots. Do you remember which ones are the most tender? Maybe
just where the C3, C4
C3, C4 is.
Yep,
And what
and
about the
then
jaw? The jaw is quite tender, and then
the
up
upper
here,
traps, yes.
up at here, and then maybe this one
Yes.
here. Make it jump. Okay. Okay. So was a bit tender turning to the left, wasn't it?
Yes, and to the right. as
And to
well.
the right. So it's a bit tender to the left there. Okay, and to the right as well.
It's very tender.
Very tender
I can
turning.
feel it up here.
Okay. Okay. All right. So now I'm going to trial treat those tight spots.
Okay.
Okay. And we need to choose one movement and use that as the reassessment. So which direction do you feel the most tender? Probably most tight. Probably
Yeah,
to the
right.
to the right.
But
Okay.
I can't really assess it anymore because I've just got used
Just
to the
tight.
pain. Yeah.
Okay. Now, so Judge Chantal, just to remind you again, in this way. Okay. It's actually a bit tighter going that way, I think.
Yeah.
To the left.
I think so.
That's all right. All right. So I'm going to press on the tight spots.
Yeah.
Okay. It might be a bit tender. I'd like you to
Sure.
bear with me.
Sure.
Okay. However, if you turn with the movement, if you feel any pain, any discomfort in your neck, I'd like you to stop.
Sure.
Okay.
Okay.
Don't push through it.
Sure.
Okay. Also, if you feel any dizziness, you need to let me know.
Okay.
All right. Okay. So should we have the first point? So try to ignore the pressure here. Just focus on your neck. Okay. There. Okay. Let's turn to the left side.
Oh,
How's that?
yeah.
What happened? Was that better or
Yeah. I don't feel anything.
don't feel anything?
Yeah.
Okay, we didn't prearrange this, do we? You swear to God?
No.
Yeah. So yeah, just do it a couple more. Okay. Feels good.
Yeah.
And again.
Well, I feel like I have movement back.
You got movement back. Okay, now this time, as we turn to the end, can I ask you to push with your hand, just make you go as far as you can without hurting. I mean, if it hurts, you stop. How does that feel?
Fine. fine. I can feel a little bit of strain.
Just
but
a
I
little
was-
bit of
yeah,
strain.
Yeah.
But it's probably normal. Okay, but it's probably too painful here
Yes.
and make you forget about the
Yeah.
neck pain. Okay, let's try to turn into the left. How's that feel?
That's good. It's really good.
That's really good.
Yeah.
Is that good? Yeah. Let's put our hands together for Aneta. Okay. Thank you very much.